Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Today, I am delighted to be speaking with Monica Oss, the founder of Open Minds. Monica also serves as its chief executive officer, executive editor of its publications and websites, and executive lead of its consulting engagements. For the past 3 decades, Monica has led the Open Minds team and its research on health and human service market trends and its national consulting practice. She is well known for her numerous books and articles focused on the strategic and marketing implications of the evolving health and human service field and its focus on the verticals of the field serving consumers with chronic conditions and complex support needs. Monica joins us today from lovely Gettysburg, Pennsylvania. Hey, Monica.
Well, good morning.
Unfortunately, people can't see what I see, the lovely plants and foliage with which you're surrounded. Could you describe could you paint a visual picture for our
Well,
listeners?
I certainly can. As you said, I'm here in lovely Gettysburg, Pennsylvania. I'm an avid gardener. So not only do we have beautiful springtime outside with all the flower, apple and cherry trees in bloom, but around me are all my 45 favorite plants that are waiting to be liberated and moved outside for the summer. So this is always my favorite time of year, and it makes me happy just talking to you.
And these are, well, I'm delighted to be speaking with you as well. So thanks so much, Monica. 45 favorite plants, did you say?
Yes, that is it.
I see. And how fixed is that? What does it take for a new plant to enter the pantheon of 45?
Occasionally it is someone will give me a new plant that becomes a favorite, or many of the cactus that you see behind me, I've had for almost 40 years.
Oh,
So
really?
some of it is just age. They've been with me a long time.
I see. All right. Well, that is very good to know. Again, Monica, thanks so much for spending the time. As I mentioned in the intro, you founded Open Minds close to 38 years ago in 1987, peering through the mists of time, well before social media, cell phones, and the internet. What did the field look like? What were the major challenges that prompted you to found Open Minds back then?
Well, it was a funny thing. I was a founder of one of the first managed behavioral health firms. I came from physical healthcare, and the mental health space was really new to me. Everything about mental health and addictions, and there were a couple things. If I can paint the picture of the field, and people will find this hard to believe, that the average length of stay in a psych hospital back in 1987 was 33 days. Today, it's 3. There were really very undeveloped community and wraparound services. There was not the pantheon of medications for mental health and addictions that we have now. I mean, it was a very different field. But what prompted me to start Open Minds was really as an analyst. I was very surprised at the lack of data that was being used both in managing behavioral health benefits and managing the practice of behavioral health, and the absence of really best practice management models. So my idea was really, could you start a company that just informed people about what is the newest data, what are the newest management practices, and the rest is history.
Yeah, no, it's an amazing run, Monica. Kudos. And by the way, I believe this is the first podcast I've ever done where the word pantheon has been used twice. So we're making history here, Monica.
Oh, well, good.
So in that sweep of time, what have been the one or two most consequential changes in the field, apart from advances in technology, which is kind of obvious? And what is the single biggest challenge going forward?
Well, I think there have been two things, if you look at the past 3 decades, that have markedly changed the field. And maybe I'll amend that to 3. One of them is the medications that we have now to treat mental illness and addiction have really revolutionized the field. I mean, they are, for all their imperfections, side effects, everything else, the newer medications that have come out to treat addictions and mental illness have markedly changed treatment for the better, I think. The second is really the advent and use of managed care across the entire healthcare field. In 1987, managed care was largely used by employers and employer health plans. Since then, we now have almost all employees who are insured by employer-sponsored health plans are in some kind of managed care plan. A little over 80% of people in Medicaid and a little over 60% of people in Medicare. So health plans have changed a lot. And then I think the most seminal change to the health insurance and healthcare field in general was the passage of the Affordable Care Act, which brought us behavioral health parity, the end of pre-existing condition clauses, and the elimination of annual and lifetime limits in terms of health benefits. So I would say that those three things have markedly changed the landscape in which we all get services and in which health insurance and provision of care actually happens.
Yeah, that's amazing. 3 days or 33 days to 3 days.
Yep.
That's pretty remarkable. And the biggest challenge going forward, if you could reduce it to one.
Well, I think our right now the uncertainty about where we're headed in terms of federal policy around many healthcare issues is probably the single biggest challenge. And in part, it has been some things that have happened in the past 90 days that have markedly changed the landscape, but there are some other changes on the horizon that I think could be as influential as the Affordable Care Act in changing how care is financed and how it's delivered.
Wait a second, 90 days? You sure that's correct? It feels easily double that, no, Monica?
Yeah, I guess it is officially 100 days. So
Yeah,
yes.
no, I'm teasing. It's been a whirlwind, to say the least. But which actually tees up the next question and is really what I want to focus on in this conversation. The Open Minds Circle Elite Executive Roundtable was held last week, and you focused generally on healthcare policy and market trends in 2025, from policy changes to new technologies and competition in the space. First, if you would give our listeners some background on this project, on some of the trends you've identified, and then I just sort of want to go through them a bit.
Yeah, well, last week we really had a chance to do two things for our members. One of them was to kind of give our members an update on what are I would say, the late breaking developments that are part of the market trends that are reshaping financing and care delivery, particularly for consumers with behavioral and cognitive conditions. So that was a big part of it. The other part was really, as you can well imagine, if you're the manager of any kind of organization right now in the healthcare field, your big issue is with the degree of uncertainty that we face for the rest of the year, how do you manage through this kind of market chaos? So the other piece of our roundtable last week was really introducing our kind of chaos leadership framework. Our team has put together kind of a three-part plan for how should executives kind of change their approach to strategy and management to kind of navigate through all the I would say the rip currents that are around
Sure.
us.
Rip currents, that's a very good way to put it. Yeah, I want to get to that. But first, again, I just want to go through some of what you covered and some of the takeaways. So let's begin with the current and pending changes from Washington. What were the main takeaways there?
Well, I think there are I could probably put it in kind of three buckets. We have a group of things that have happened in the past 100 days that I think are have already had a market effect on the field. I mean, the two that affect organizations that are dealing with people with behavioral and cognitive disabilities is that CMS has withdrawn the two guidance documents that are related to paying for health-related social needs and Medicaid. And they also, separately, a few weeks later, issued a statement that going forward with Medicaid waivers, they will not be willing to pay for any services that are non-medical out of the in terms of federal match for Medicaid. And you may ask, why does this matter? It will substantially change how some of the state plans, health plans, and provider organizations are actually delivering services for folks on Medicaid. Over the past decade, we've seen federal policy and states embrace the fact that you need things like wraparound supports for housing, peer supports, home care for activities for daily living, things that are not medical, but really help people stay out of institutions. Those funding streams appear to be on the chopping block to go away. We've also seen, they are going to eliminate SAMHSA, the Mental Health and Substance Abuse Agency, and HRSA, the agency that is responsible for funding our federally qualified health centers. Those will be abolished and replaced with a Uber agency called the Administration for Healthy America. And even in the short term, we've seen canceling of a lot of grants for public health, including about $1 billion in mental health and substance abuse grants. So those are just a few of the many things that have happened in the past 100 days. Long term, if you look at kind of the administration's Project 2025 plan for healthcare, we are seeing things like the reduction or elimination of the Affordable Care Act, moving Medicaid to a block grant and moving it to the states, making Medicare Advantage, which is the managed care plan, a default for all 65 plus beneficiaries, and the proposals to eliminate Head Start and Housing First funding. These are sort of top of mind with the administration in terms of their Project 2025 playbook. And I think these things will have, I think, five big effects for people who are likely listening to this podcast. One of them is we are likely to see a rise in the number of uninsured consumers as a result of these actions. There will certainly be substantial reductions in federal grant funding, which means state and local government will have to raise taxes to pick up, kind of pick up the balance of those missing funds. And I think the bigger challenge for most folks is that Medicaid will move, which insures, by the way, 25% of the population, will move away from a kind of a program with federal oversight to a program that will be designed and managed at the state level. So I think those are really kind of the both the things that have happened, what is likely to happen as they implement the Project 2025 playbook, and I would say the big market effects of those things. Does that make sense?
Yes, it makes sense, and it does paint a pretty terrifying picture. It's less about having a roadmap and figuring out how to pick one's way through the rubble.
In many ways, yes. It is if you think about change, this is not an evolutionary change. This is much more a change in paradigm.
Yes, I think that's a charitable way of putting it. Tell us about your findings regarding what you call the new science, technology, biotech, pharmaceuticals that's reshaping service delivery.
Yeah, well, we have, I would say that our bioscience and tech sector, when it comes to kind of these consumer verticals, really are in two halves. I mentioned earlier, the kind of breakthroughs that have already happened in kind of medications, but every week I see kind of new technological innovations that have the potential over the next decade to have kind of breakthrough status. We're seeing deep brain implants, the use of transcranial stimulation in treating depression and Parkinson's disease, great new virtual reality therapies that we're seeing being used to treat everything from pain management to anxiety disorder. So on the, I would call it the applied treatment science side of things, there are, we could do an entire podcast and maybe we'll have to do another one just
Happy
on
to.
the new technological innovations that are really proving to have some, a market impact and have great potential for treating diseases that have been limited in the past to therapy and medications. It's kind of a third leg in the stool, so to speak, of treatment.
Sure.
The other
Well,
piece we're seeing is the use of artificial intelligence, or I prefer to call it augmented intelligence, new computing power that has the ability, I think, to, one big benefit is in making our current clinical teams more productive. So there's administrative productivity. I think it has the potential for reimagining consumer experience in some positive ways. And developing more robust analytics for decision support. So I think there are some tremendous potential for artificial intelligence in the field. There are also some real dangers, and one of the big, I think, challenges ahead is how are we going to get the best of artificial intelligence, but and also regulate the potential downsides at the same time. But I think those are the two big things. It's the kind of revolution in bioscience and what we see coming with kind of AI and technology.
well, hearing that is a welcome tonic to the previous question and what's going on in DC. So thank you
Mhm.
for that, Monica. What did you discover vis-a-vis the changing competitive landscape from health plans, hospitals, retail health, and private equity sectors?
Well, so in the midst of all of this, I like to think of this as sort of chaos coming from three ways. We're having all these big policy changes, completely separate in many ways, all these new scientific and technology developments. And then we are seeing a real change in the, I would say, the structure of both how we finance and deliver services. And there are a couple, I would say, big things that we want to be thinking about. One of them is we are seeing, I'll put it this way, the pandemic was very good to health plans. And as I mentioned earlier, enrollment in health plans, as opposed to traditional fee-for-service plans, went up a lot during the pandemic. And I think the actions in Washington that we've seen already are likely to increase health plan market share. So health plans have a bigger role in controlling dollars. But the other thing health plans are doing is they're developing their own delivery systems. I like to say they are backward integrating and becoming payviders. So you have and a couple examples for the people listening. United Optum has acquired, I don't know how many dozens of provider organizations that they now own and operate in mental health, in occupational health, in home care, in home health care. Elevance, Carillon, that group, they are building their own de novo clinics. Cigna is actually building its own behavioral health provider group. So there are some changes at the health plan level. We also have now almost, I'm trying to remember the current stats. I think it's almost 4,000 retail convenient care locations for care delivery in everything from Walmarts to obviously the CVS chain, the Walgreens chain, mobile health clinics. I mean, we have seen an explosion of retail health. And lest anyone think that the retail players are limited to giving you vaccinations, they are expanding their footprint in chronic disease management and working with health plans as well. And then I would say hospital systems, post-pandemic, have found that their future lies in doing outpatient services. I mean, while we are underbedded in some markets, generally speaking, we have an oversupply of hospital beds, and that hospital systems are really moving to developing, I would say, complementary outpatient services as part of what they're doing. And then last but not least, on the competitive front, is I would say, growth of private equity owned and operated nouveau companies in the healthcare field. In the latest estimates we can see is that we can find is that about 7% of behavioral health provider capacity is currently owned by private equity firms. So those four things, if you think about changes at health plan, changes in retail clinic, changes in health and hospital system footprints, and then the emergence of retail or of private equity players in the field are really mixing it up, if you will, at the delivery system level.
Yeah. By the way, you've already given me about 5 ideas for other podcasts we could do, Monica. So,
Happy to do it.
yeah, no, I would love to bring you on going forward to focus on some of these things because, yeah, easily each of these categories lends itself to a full podcast. Would love to do that. So, finally, now that we've successfully built up all of the drama and suspense, we have everybody on the edge of their seats. This chaos framework, Monica. Please
Mhm.
explain this to us.
Well, so as you can well imagine, if you look at management best practices for any enterprise, they look, what executives and managers need to do in times of relatively stable markets is different in times when markets are experiencing a change. And there's a lot of research that shows that business enterprises that engage in growth strategies in times of turbulence tend to be the organizations that do the best when that period of turbulence is over. So I think the only compounding factor is that I would say that the current market situation and what we see coming in the year ahead is really beyond turbulence, and I would call it chaos. And the definition of business chaos, by the way, is when market changes are not only unexpected, but they are, what was they going to say, illogical. There is actually a definition of business chaos. I think we are firmly in that chaos period. And our recommendation to our clients, our members, is they need to be thinking about reframing their management approach in 3 buckets. There is the short-term financial issues dealing with cash and financial sustainability and strength. There is having an aggressive growth strategy. And then there is all of the time sort of preparing for and having a long-term vision for what the post-chaos market is going to look like. And my advice for executives is be rethinking not only strategy, but also how your day-to-day management of your senior team along those 3 lines to help you navigate what is going to be a market environment that's going to favor the nimble. I'll put it that way. Does that make sense?
Yeah, no, it does make sense. The framework makes a lot of sense. Those 3 buckets make a lot of sense. Ultimately, it's all in the implementation and hitting senior leadership and everybody in the organization to gather around and rally around and understand this and develop their own vision for it. It's one thing to say
Mhm.
it's a framework. It's another thing for an organization to embrace it and implement it in a systematic way where it's actually
Yeah.
effective. So are you saying that there is a standard accepted definition for business chaos? There are certain characteristics where it's like, okay, if you check these boxes, you are essentially in the red, you are officially in chaos.
Yes, yeah, and I was hesitant to use the word chaos last week when we announced this framework. We were looking at softer words like, turbulence or market change. But the more I looked at the definition of kind of chaos from a business perspective, Yeah, it really does fit the current market environment because the changes are not evolutionary, they're not expected, and they're not logical.
And to say that there's uncertainty, I think is underselling it.
Yes.
Chaos, I think, does capture the moment. Yes, a lot of it just seems wanton. You talk about making change with a scalpel as opposed to a wrecking ball. It seems that while they pretend that's the former, it's very much the latter, and things seem to be also so arbitrary and capricious. So, what do you do? How do you get in front of that? How do you game plan that?
Yeah, I think that to me, if I think about what are the challenges facing a typical, healthcare organization, their board, their executive team, I think there are a few things that this period of chaos brings. One of them is the executive teams are going to have to take a hard look at what they can continue doing. As we see these big shifts in reimbursement and in competition, by the way, not everything that an organization has traditionally provided is necessarily going to be something they can afford to provide going forward. So I think it's really tough for executive teams and boards of directors to make those service line decisions. That's one. Two, I do believe, getting back to our discussion about the kind of biotech and technology issues, this is the path ahead for healthcare organizations is going to demand some significant investment, both in new service lines and in technology. And I think the executive teams need to be very practical and realistic when it comes to assessing whether or not they have the capital to actually weather this change and kind of develop, weather the changes afoot and invest in a growth strategy. I think there's also the issue of how do organizations try to rethink their strategic vision? What role are they going to play in the community going forward? We're seeing a lot of, if you thought about either whether you're a hospital system or a small, independent private practice in the market, there's, the role of the players in the healthcare field is being changed as we speak. And executive teams need to be rethinking that kind of vision for going forward. So I think those things, service line management and what to discontinue and invest in, being realistic about capital, and all along the way trying to develop this vision for how do you fit in your community's healthcare ecosystem going forward are going to be three big challenges.
I tell you, Monica, this podcast has turned into sort of a one-stop shopping for everything important
Yeah.
that's going on in this space and what one needs to do to navigate the chaos. Let me end by just asking any interesting initiatives going on at Open Minds the next 3, 6 months. Here's your chance to make a big announcement.
A big announcement?
A
Well,
big
I
announcement.
think we have a couple things I'm really excited about. Certainly our framework for navigating chaos last week was kind of a big piece of intellectual work from our consulting team. We do have our Strategy and Innovation Institute coming up and our Service Excellence Institute coming up, both of which are going to be very focused on this, I would say, chaos framework. How do you innovate in times of great market change? And how are you remaking, what it means to have excellent service along those times? So I think that area of focus is something that we are kind of really excited about and kind of bringing to our members. I would say the other piece is just we are doubling down on kind of market intelligence for our members, largely because here's an interesting change. With all of the cuts at the federal level, access to information about healthcare is going to be even more difficult to find. We relied on AHRQ and HRSA, SAMHSA, the CDC, to provide baseline information about what's happening in the field. My big fear is that those things are not going to continue. And that as, from a big picture system, those things are not available. So I think that, what we're trying to do is figure out in our small set of market verticals, how do we try to fill that gap? And expand what we're doing to make up for some of the, I would say, the missing federal data, long term. So those three things, the kind of helping organizations survive chaos, embedding that in all of our educational institutes, and thinking about what are the information needs of executives in this new environment, are three things that I spend most of my time working on.
Yeah, I also noticed going over your site, you're also doing some really interesting things with regards to AI.
Yes, we're doing, we're trying to help the field both understand the potential for AI. How do I use the things that are there that could really make a difference for consumers, a difference for my financial sustainability, and at the same time put in a governance model that protects both the consumers and the clinicians from some of the unintended consequences of AI. So it's really a balancing act.
Yeah, no, indeed. I tell you, Monica, you know how teams or players on teams, they look at the schedule as it's posted before the season starts and they circle certain dates when teams are coming
Yep.
into town. I had this date circled because we had scheduled this several weeks ago, and I was really looking forward to this conversation. It's everything I thought it would be, Monica. So thanks so much. I really do appreciate this.
Thank you, and I look forward to hopefully a ongoing dialogue about what's happening in the field.
Well, I was about to say that you are already committed to that verbally. This is being recorded, so I always have that Damocles sword to hang over your head if it goes the other way, Monica. But again, thanks so much, and I will take you up on that, just so you know.
Great. Thank you, and have a great day.
You too. Today I spoke with Monica Oss, the founder and CEO of Open Mind. She joined me today from lovely Gettysburg, Pennsylvania, surrounded by 46 of her excuse me, 45 of her favorite plants. Who knows, soon to be 46. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.